One. Good evening. This is Dr. John Bennett, televising from Miami in the first hangout for internet medicine. And tonight we're exploring the space of 3D printing and orthopedics. We have the pleasure of having Bruno Gobbato, MD. He's an orthopedic surgeon from southern Brazil, and he's a 3D printing enthusiast. Before we turn it over to Bruno, let's first meet people on the panel. Good day, Gio.
Hi, good night.
Could you please introduce yourself, tell what you do and stuff like that?
I'm a medicine student from Buenos Aires. I'm in third year, and I have interest in neurosurgery.
Very good. Welcome, Gio. And Jorge.
Thank you, John. Well, I'm an engineer, electrical engineering. My PhD is chemical engineering, and I've been working in this area of 3D printing since 20 years ago.
Yes, and we've had a few hangouts with Jorge. And Yasser.
Hi,
could you please introduce yourself? Okay, go ahead.
Yeah, I'm a research engineer at Align Technology. We make the Invisaligns orthodontic appliances using 3D printing technology.
Yeah, and you work in the field of orthopedics, correct?
Yes, previously, before joining Align Technology, I was at Stanford orthopedic surgery department working on 3D printing for bone tissue engineering applications.
Very good. Welcome, Yasser. Okay, Bruno, it's all yours. Could you please tell us a little bit about yourself, where you trained, and how you came upon 3D printing? Please, thank you.
So, okay, can I share my screen, John?
Well, why don't you just talk about yourself first,
Okay.
What you've done, where you've trained, etc.
Yeah. Okay, so I'm an orthopedic surgeon here in Brazil. I'm in southern Brazil. I'm in a small city, a city that doesn't have a university. I work in my own private practice in my clinic. I started 3D printing actually when I saw a video on YouTube from a huge company called Materialize. They showed how to create some guides for a surgery. I really think it was 2013. I saw that video and I thought, well, I think I can do this else. That's not that was not something that I really think we can do this. So I have researching from about 3D printing. I have learned about the rep community. It's the 3D printing community that almost makes their 3D printing sometimes at home. And I have bought my 3D printing early 2014 and started creating my models and planning my surgeries. And I'm from the last almost 3 years using almost every day in my practice, in my bone cases and fractures, and I have developed some tools to help me in my surgeries. And some of these tools I'm trying to share with other orthopedic surgeons, shoulder surgeons, to help introduce this new world of 3D printing. I really think this is it's a tool that almost every orthopedic surgeon and many other specialties will have in their offices, even in their home, to help understand the anatomy, to train, and everything else.
Okay, very good. Why don't you do your presentation, and then we'll ask questions after you do your presentation.
Okay. Okay, just starting. Can you see my screen? Okay.
Yes, that's good.
Yeah,
that's good.
yeah.
Okay. So this is the first screen. I have no disclosure for this presentation. For those who are not in the medicine, we are talking for 3D printing enthusiasts. There will be some blood in this presentation. So it's take care of some images. My goal in this presentation is to talk about 3D printing medicine in orthopedics as an individual, not as an academic, not as a big hospital, not as a big company, and how we can use the 3D printing in your office, even in your home. That's my main goal. I'm on 4 3D printers. This picture I have just taken. As you can see, I'm here in my home office. They are 3D printers. As you can see in this picture, I have 2 Prusa. Prusa is a, how can I say, it's almost like a homemade 3D printer. I have a 1/2 3D printer. It's a Ultimaker copy. The community knows these names I'm telling. And a mini boat, which is it's a local 3D printer from Florianopolis. This is the material I use to create my guides. I'm just showing some examples. This is a foot viewing from above. This is a calcaneal fracture, a malunion calcaneal fracture. I can show you. This is the video showing how we have printed this calcaneal fracture to plan the surgery. Here we have only the calcaneal, and we use this to plan where to place our cuts. I'm going to show some examples. This is a regular foot. All these models are from real patients, from our patient, from patients who comes to our clinic. So here is an example of a foot. This is a regular foot. It's just for showing, but we can see how close to the anatomy. And here I have some other examples. In the left, we have a malunion of a tibia fracture and a humeral, proximal humeral, regular humeral in the right. Here we have in the left a glenoid, and in the right a hip fracture, a tabulum fracture. This is a trauma case from our hospital. And every time my colleagues have some difficult case, I 3D printed them some guides, some models to help them. Here are some examples, some GIFs we can make. Here's a lumbar spine. It's a real size lumbar spine. I bring that image to teach that 3D printing. We need some supports, as you can see, between the vertebrae from the lumbar spine. We have to print with some supports. Just as the regular disc. And this is an example of a 3D printed model. Okay, what are the steps to have these 3D printed models in your home, in your office? So we use the CT scan. Okay, other exams like MRI, they are not has the good resolution. So from any CT scan, that's important to say. My colleagues ask me, do I need a 3D CT scan? No, that's important. Any CT scan, you just need the DICOM files from the CT scan, and then we can transform it in a 3D file. Then we have to clean and prepare this 3D file because it has some artifacts. And then you can use a CAD software to plan a surgery. For example, you can create guides for your surgery, you can create instruments for your surgery, and then just 3D print it. So this is the resume of what all can be done with 3D printing. So we start with the CT scan and DICOM files. Then we go to the segmentation. The segmentation is to have all the slices of the CT scan and transform them into a 3D file. Here I have some examples of softwares. These 3 examples, Osiris, Invesalhus, and 3D Slicer, they are all free. I use the Invesalhus. It's a free software. It's a Brazilian software. I really think Dr. Jorge knows it very well. And we have some CAD for example, to plan our surgery. We can plan our surgery in a CAD software. Here are some examples like Rhino, 1, 2, 3 Design, ThinkerCAD. And even now the Windows 10, it has inside Microsoft software called 3D Builder. And we really can do a lot of stuff in 3D Builder. We can plan a whole surgery in 3D Builder. And I'm very excited using this simple software to plan my surgery. We can create guides, the PSI, it's the patient-specific guides or patient-specific instruments to help in surgery. We're going to show some examples. And then 3D print. You can 3D print yourself in your office, like me, or you can have other 3D printing services like Materialize, and okay, it's not that difficult. It's easy, and it's very, very cheap. The material is very cheap. Of course, time is not the time is, I'm not counting on this. So the segmentation, as I was telling you, is to transform the CT scan into a 3D file. I use the Invesalio software. Everyone can use. It's very, very easy to use. Everyone can download. We have to clean the 3D file. I use free softwares like Mesh Mixer and Mesh Lab, so they are not difficult to use. It's almost like a Photoshop for 3D file. Here, example, a picture of the Invesalios. I'm showing how we select the bone. In green, we are selecting the bone, and then with one or two steps, we have in the inferior part of your right screen the 3D reconstructed file. We can export. We export to a STL file. It's the file we already use for 3D printing, and prepare them. As I was talking about, we can use also CAD softwares. I bring that slide because all my steps passes through a CAD software, because I just don't print, but I generally plan my surgery in CAD software as well, and then I 3D print and we do it in real life. So the indications for orthopedics is the most. There are almost every specialty in orthopedic can use 3D printing. I'm not going to make an academic lecture. I prefer to show more examples of our life, of our practice. So I'm going to show more shoulder and elbow examples, because so here we have a clavicle. So this is a 3D printed clavicle model, and we can see there are many different implants, plates, and different shapes of plate. And the 3D printing help us to choose the right plate, for example, for the patient, not to choose this during surgery if the patient open. And it's a very simple step, but it takes some time. And for me, time is not money, but time is less infection. Time it's very important during a surgery. Here I'm going to show you a video. This is my how can I say, all the steps I create when I create a 3D file. As I talked to you, I don't only print it. I use the CAD software to plan the surgery. Here I'm aligning the fragments of a fracture, a clavicle fracture, as I can show. I test in the CAD software the best plate for the fracture. This is approximation, of course, and then I prefer 3D print. We can even 3D print guides. I'm going to show you next in the video. These guides I'm going to attach to the fragments of the clavicle. They show me where to place the plate, and to make sure the plate is in the correct place. Clavicle is it's not, the clavicle fracture is not a difficult fracture, but it protects main arteries like the subclavian artery. So to make sure where you are is it's almost very important in surgery, principally in clavicle surgery. Here an example of how it's a regular fracture is done. So we have to exposure, have to make a skin incision in almost all the clavicle to make sure the plate will be placed all along the clavicle, and the screws won't be in other part of the clavicle, as the clavicle is a S-shaped bone. So with 3D printing, we can create smaller incisions. As you can see here, we have a smaller incision because we know the plate's in correct place. And this is one of our first cases. And now we are doing just like this. We have a very small incision. As you can see in the image, the lateral fragment is already drilled. We have drilled before the surgery, so we know for sure where the drills will be, and we can make a small incision and make sure the plate is all over the clavicle in correct place, and the screws are in correct place. So this is our day-by-day cases. I'm showing here a proximal humeral fracture. This was a very difficult case. This is a male patient who had a posterior dislocation and a fracture. He's an elderly patient. Everyone else was telling, we can't fix this fracture. I have tested in a CAD software. I really think, oh, well, I think I can fix. It's possible. So I choose to 3D print it and test with the plate. And yes, we could fix, and this patient is very well. Some examples here in real life. This is that same patient I told. In real life, in real surgery, we don't have access to all the bone and to all the structures. This is the view we have from the proximal humeral fracture. As we can see here, this is the bone we have. This is the view we have in surgery. We have blood. Sorry, and to have the 3D printed part in our hand helps a lot. But for example, for the proximal part is even important. This is how we see the head of the humeral. As you can see in the arrows, it's difficult even to identify the anatomy, because we have many tissues around. We have tendons, the rotator cuff, we have muscles, and that's in the arrow. It's where it's almost like the landmarks we use. So in surgery, you almost have like this landmark only. So when you have the big picture, when you have the whole model in your hands, the surgery went very well. The surgery went with less time, and we are sure where we are and where the fracture are ending the surgery. We have developed some guides as well. Here I'm showing you. This is the superior view of a humeral head, and I'm attaching a guide. This guide shows me where to place the plate during the surgery, because when we place a plate, we have to use fluoroscopy, we have to use intraoperative X-rays, and having these guides, we don't need to use fluoroscopy. Some surgery I use no fluoroscopy at all, because I know where the plate is, I know where to put the screws, I know even the size of the screws. Here I'm showing some example. This is a locket plate for a proximal humeral fracture. I'm showing you how we test before the surgery, and we can do a small exposure. This would be, the points would be almost like the regular incision, I think, for everyone, and we can do a small incision knowing where the plate is and knowing where the fracture is. So here an example of how the exposure, we can do minimally invasive techniques. Let's change a little bit from subject. This is I downloaded today actually to this presentation. This is it's a drill for orthopedics surgery, and it has a surgical measurement tool in the drill to know how much have you drilled the bone, for example. This is a very high cost drill. This cost, I really think this costs over $10,000, and it's almost impossible to have this kind of technology in a country like mine in Brazil. We have others listeners here from Latin America. This is almost impossible for us to have this kind of technology. But with 3D printing, this I have designed it. Copying, of course, this copying is it's a hard word, you know. Inspired by this tool, we have designed it with using regular solids in CAD. It's not that difficult, and I have designed my own measurement guide for orthopedic surgeon. This is just a test. Of course, I'm not using because it doesn't have the precision I need, but it's an example how you can create your own measurement guides or your own instruments for your surgery. This was drawn by me. I'm not an engineer. I don't have knowledge for CAD. With some YouTube videos, we can learn and develop this kind of stuff. This is a guide for a glenoid. This is a scapula glenoid. I have developed this guide to help me create do a surgery called shoulder replacement, shoulder arthroplasty. The main goal for the surgery is to have this pin placed in the right position. And this guide, as you can see here, aids me to place it in the exact position. Not in position is not the not even in position, but the right angle. I'm going to show other examples in real life. Here, an example of a very difficult fracture. This is the patient has a motorcycle accident. Here we have, in Latin America, we have many motorcycle accidents. This is the scapula and glenoid fracture. And we have 3D printed this fracture to help us how to address this surgery, where to expose it, and even the most important part, where to place the screws, because the fracture is very close to the axillary nerve. So we have 3D printed. This is an example of exactly that case of the 3D printed part of this fracture. This is another example. This is a patient who had a shoulder dislocation. You can see in the image that he had an anterior part of the glenoid, a fracture in the anterior part of the glenoid. And we 3D printed it to understand. Here it's a small video how this can be done with a regular 3D printing. We can see the quality of the image. It's very good. And we can develop, for example, some instruments to help us during the surgery. This is the same patient we are showing. We have made an osteotomy to his coracoid process, and we have made some guides to show me the exact place to place our screws to help this patient with his dislocation in his fracture. I'm going to move on. Here an example of how the guide attaches to the 3D mode. This is almost like how can I say? I have all these cases I publish in a sketchfab.com/ortho3D. So it's very interesting for medicine students to look from many different cases. They are all free to use and understand shoulder instability cases and fractures. So you are all invited to look at this gallery. This is the example of one of my 3D printers. This is the duplicator. As I'm just showing, this is in my office. This example of, sorry about the sound, but this is how a 3D printer works for those who don't know, who doesn't have the access to this. They create layer by layer printer. Here I'm printing just a small box. Here example of a proximal humeral fracture I have printed. Here are some examples of our day-by-day use, some guides, some fractures, some scapulas, some clavicles. Here I'm showing my other 3D printer printing the scapula, and here I'm printing proximal humerals. Let's continue. Well, let's talk about some Caston Splints. It's something that when we think about orthopedics, we think about splints, casts, and everything else. This is a picture from the internet, but we had already tried our own cast. This was printed. This model was downloaded free from Thingiverse. I have made a little modifications, but it's not my model. And we have 3D printed in PLA. Sorry, this is just the video, and here's the final version. I have tested it myself. It worked well. Of course, it's not for a fracture, but it could work for example, for a post-op case. This is printed in PLA. PLA it's a plastic. It's biodegradable, and we can melt. We can bend it with hot water, so we can mold it around your wrist, and it worked very well. Talking about surgical instruments, it's when you enter OR, not an OR room, but OR storage. There are many, not many. There are many shelves of instruments, and I myself have more than 200 instruments only for shoulder surgery. I have 2 big boxes of instruments to have my shoulder surgeries, and I really think 3D printing and additive manufacturing will change this. We have tried. Here is an example of another 3D printed design I have created to place screws in a patient bone. I have downloaded from Thingiverse sorry, I forgot the name in English for this kind of instrument, but okay, a plier. I think it's a plier or plier, and we have redesigned it as an instrument to show me where to place screws. Here I have the bone I have drilled. I'm going just to show you how we done this. This was made in nylon with a regular 3D printer. It holds the bone in very well, and it shows me where to print the two screws that in order them to be exactly parallel to each other. You know, it's important in this kind of surgery. Other surgical instruments we have tried. This is the U.S. Army instrument. Is very used in U.S. of course. And here we are showing how we used during surgery, and it worked well. You know, I have 3D printed here in my home. This is another examples of shoulder dislocation. Here I'm going to show you just to make to understand how this is. This is a regular surgery. Okay, this is it's different to understand. Even for me, I'm a shoulder surgeon. It's very difficult to understand. But here we are drilling the anterior part of the glenoid, and for this shoulder to be correct, we have to drill those two screws I just have shown you before, 7 millimeters from the glenoid surface, and this is done by looking at them. Oh, I think it's a 7 millimeter. I think they are parallel. I'm not going to how can I say, the magic of the surgery and the magic of the surgery. Oh, they are all precise. Yes, we are precise, but sometimes, or many times, we do things by looking and then think, oh, I think it's okay, and I really think that's not the correct we should do this the correct way. So we can create some guides to help us. Here I'm showing you a guide that show me exactly where to drill that two screws, them to be exactly parallels, and that's important to have the surgery done. I'm just ending my presentation. I'm going to show you here another example. This is a shoulder arthroplasty. It's a very high-end surgery, and this is a video. We are planning the surgery in CAD software. This shows me where to place. As you can see here, the cylinders, they are the screws that hold that arthroplasty, and the red cylinder is that pin guide I have shown you in the first slides, that I talked to you about that guide that shows me where to place exactly. And we can plan the surgery and we create 3D guides. This is the patient, for example, glenoid, and using this kind of models, we make sure where to place the screws. Here I'm going to show how a regular surgery is done. Okay, this kind of surgery, this kind of shoulder arthroplasty. This is the view we have, and this is how can I say? Sorry, this is the best view everyone can see, because this is videotaped. In real life, we don't have this view that much, and the surgeon are trying to create that first pin, and he has to place the pin in exactly the way I showed you in the first slides. And the surgeon, how can I say, we have a feeling that it's in correct position, but you can see it's not possible to make sure it's in the correct exactly angle. Looking from the arm, looking from everything, we use this as reference. But with 3D printing, we can create this kind of guides as I show you, and make sure our pin is in correct place, and we make sure our arthroplasty, our prosthesis will be held in correct place. Well, I hope that every time I have a 3D printed model, it came well, just like this. Of course, this is not it's not always sure. Dr. Jorge knows that. sometimes we wake up after a night printing and we found this, but learning how to work with 3D printed models, learning how to work with the 3D printed files, day by day we are having less trouble with 3D printing. Everyone who starts with 3D printing will have these images, I'm pretty sure. I'm pretty sure the first month of 3D printing will be almost like this we're going to see, but after a while, I really think 3D printing is a tool for everyone, okay? And the machines each year, almost each semester, they are more plug and play. They are more reliable. Sorry, not the answer, but not the word. They are reliable, and I'm really thinking in a very few years, a very couple years, we will have in our desktop printers that doesn't come like this. Thank you very much. My email is bigobbato@gmail.com. We are posting some of these cases in Twitter, Bigobbato 1981, in LinkedIn, and everyone who wants to talk about 3D printing, who wants to learn, I'm very open. I really like this subject. So everyone who wants to talk with me and can send me an email. I really like to connect to people, share knowledge, share difficulties, and maybe share solutions. Thank you very much for the invite, John. It's a big pleasure to be here, to talk in English, and to have Jorge listen to my presentation.
Well, excellent, Bruno, excellent. We understood it very well, very clear, great illustrations. In a field which I'm sure is going to increase in importance. It already is growing, and I'm sure there'll be a day when we do all our casting with 3D printed materials. And by the way, for Gio and Marco, 3D printing is used in neurosurgery also to show models for patients to educate them. And now, okay, since Jorge and Yasser work in the field, we'll let them dominate the questions and comments. So, would you like to say anything, Yasser or Jorge?
Yes, maybe Yasser can start before me.
Okay, whatever. Yasser, you want to comment or have questions?
Actually, the very interesting presentation. It's I enjoyed the cases that you presented. I have a couple of questions. Maybe we can start with a quick question about the material you used for surgery guides. So you mentioned some of them are being fabricated by Materialize, and I'm guessing those are SLS printed nylon material, right?
Yeah, sorry.
Am I correct?
Yes. They use nylon, SLS nylon. I think they use nylon 16. I'm not sure, but the number of
66.
nylon polyamide. 66.
Nylon 66. It's polyamide.
66. Yes, polyamide. I'm not sure the exact number. I'm using nylon as well. I'm using Tallman nylon. It's a FDA approved material. I'm not sure the number. I can check. I have here a spool right now. I can check, but I'm using nylon for guides. For models, I won't use in surgery. I'm using ABS and PLA, which is the plastics as we use. Nylon is not easy material to work with, but can be done. It's not it won't come out perfect in the first time, and I don't create big models in nylon, but it can be done. Polyamide, it can be done, and it's safe. There are some articles that talks about PLA safety. It's a biodegradable material. It's hard to make sure because we are not we don't have the we don't have the material where the material came from. Yes, from the vendor, but PLA is, in theory, also a material that we can use during in surgery. It's not for implants, of course. That's important to present here. We are not using implants. We are using tools for surgery. Yes.
Great. How do you sterilize them?
Well, I sterilize most of them in hospital autoclave. Okay, PLA in a very delicate cycle can handle regular autoclave. Nylon can handle autoclave very well, no problem. ABS I don't use in surgery to contact the patient, but I generally sometimes I use after the surgery to make sure of before the surgery I bring to the OR to test some things, and it also can handle pretty much the regular autoclave from the hospital.
Great, thank you.
Okay, Jorge.
Well, thank you, John. Thank you, everybody, to be with you this night. And sorry for my informality, because I live in a ranch here in Campinas, São Paulo, and then we had a very strong storm this night, and I lost my regular connection, internet connection. So I'm talking with my cellular phone.
Oh no, we can see you fine. We can see you fine.
Right. Okay. So Bruno, first of all, it's nice to meet you and see what we're doing here in this country, that we need so much people like you that are very creative and using really good tools to develop new techniques. And it was a very clear presentation, very useful for everybody. So I think that this podcast will be very useful for many people in the world. And I don't have many questions, because it was so clear, and I've been in this field for a long time, that I cannot think beyond you talk. So my first question should be questions that if you can talk to us in a few words, how 3D printing changed your techniques, the procedures to make some surgery. I think that you are very clear in your presentation, but if you can talk about 5 to 10 words, how it was helpful for you in your clinics.
George, thank you very much for your kind words. The word that resumes it's planning the surgery, because surgeons the surgeries I want to say in automatically way. So when you 3D print a model, you stop, you prepare yourself for that surgery, you understand the anatomy of the patient, understand the pathology, and you have time to plan the surgery. For me, 3D printing is creating the surgeon time him to stop and plan and think what he's going to do, and not to do everything in automatically way as I was doing before, and as I see my colleagues doing that every day.
You remarked about the speed, and one thing that I've learned in surgery is that surgeons are very concerned about going as fast as they can. Do you see a noticeable difference with using the 3D printing and the time that you spend in the OR? Do you save time, do you think?
John, yes, 3D printing, but I have to be honest, because when I enter in the surgery, all the steps I have to do to have the 3D printed model, I have to look clear to the CT scan, I have to create the 3D file. All these steps are very important for me for the surgery. It's not just the 3D model, but it's of course the having the model in my hands. This not only time, but we make sure we are doing the right thing for the patient, and it's a game changing, you know, it's a game changing anatomy, because we surgeons are trained to recognize certain anatomy and do not thinking about the anatomy, but thinking, oh, that bump, okay, I need to place a screw in that bump. I even don't know what that bump is. I just so used to place a screw in that bump. I will always place a screw in on that bump. Do you understand? I'm not I'm not thinking what we are doing, because it's almost automatically. And when you have the 3D printing, you know, oh, this bump, I'm placing a screw here because this screw goes there, and you know, you understand what you are doing. That's, I think, the magic for 3D printing. Is
improved accuracy, correct?
Yes, of course, of course.
Yeah.
Right. Just one compliment. I always say that the first surgery is in a computer. So you do a virtual surgery. So you can make mistakes many times. The second one, you make in a model, or you train in a model. And the third one, you do it a patient. So when you find your patient, you are completely, more sure that you do the things the way it should be. So, and the second phase, when you are producing some guides or device like this, you are sure that you are transferring your planning to the surgery with safety. So that's the way I think that, as Bruno showed, the 3D printing can help this any surgery. And you told about, for example, when you see some device from a company, I don't remember the name, and you say that's a copy or inspiration. In engineering, you say it's a reverse engineering. So it's a nice name to see.
Reverse engineering.
That's right. And also when you say overnight, when you put a model run overnight and the next day you find something that's completely wrong, you say that's a nightmare, not overnight model.
There are going to be issues of that with 3D printing but if it improves outcome, do you find, Bruno, that do you use it for patient education to explain the procedure you're going to do and what you're going to exactly do?
Yes, John, I do. Of course, the patient, they are very amazed, but sometimes I'm going to be honest. I actually prefer to show them in computer, because I have the plate design, for example, we're going to do. But I really think for patient education, it's very important. I have actually not that much cases, because I work with a small part of the human anatomy. But I really think for other specialties, I think this would be even more important. You know, for fracture, I think it's understand to the patient to understand how much displaced is the fracture. It's important, not to convince him, but to show him and what we are going to do. But this is a technology. I have to be honest. Neither the patients and neither the surgeons actually believe this is true. You know, sometimes I think they are not that convinced. Oh, that's my bone. How you know? That's something that's a little bit still a little bit not in the reality for many patients, and even for surgeons. Surgeons doesn't even know that they have this kind of technology available for them, and it's not that difficult to have this.
Mm-hmm. So it's not a commonplace thing amongst orthopedists in Brazil at this point.
No, it's not. I think every year more surgeons understand. I know, but
Do you foresee the day when all operating suites will have a 3D printer?
Yes, I really think we are going to have 3D printers at home, actually.
Yeah, I think I see the day when people have, we'll have them on the desktop.
Yes.
We'll have it on the desk, a 3D printer for not only, of course, not for doing surgery, but for doing other things, making tools, etc. And one thing that maybe Jorge and maybe Yasser can comment on this. Now, one of the things I learned from having a conference in which Yasser and Jorge participated about 2 months ago on 3D printing in medicine was the fact that 3D printing is very dependent upon material science, the development of being able to 3D print various materials. Can you guys comment on that, please?
Yes, maybe I can talk some words about that. In fact, today, if we're talking about biomaterials, I think that 3D printing is opening a new world for biomaterials, a new world for scientists, not only in biomaterials, in every material, but biomaterial especially is a special thing. And even for the regular surgery, like Bruno showed us, and for the future for bioprinting, to produce materials that can be biodegradable, and you can plant cells inside those materials, and you produce some tissues and organs. So it's a challenge. It's a challenge for science, material scientists, and you have to connect both the process and materials, because you cannot go in one of those printers say, okay, I have a print now, I want to print with this and that material. Normally not. It's associated processing and material. So in this case, for example, if you are talking about metal materials, that for orthopedic surgery is fantastic. And you can open up a new world for customized prostheses. Maybe Bruno can talk a little bit after about that customized prostheses, because some case cannot be useful, but in many cases it should be useful for different things, for different applications. But if I talk about metal materials, has to be very specialized material, and still today, very, very expensive machines. At CTI, we are running since 1 year ago one Arkham machine that's a $1 million toy. So it's I invite all of you, if you want to use it, if you want to share with me some works in this metal machine, you are invited. But everything is connected. So material is a challenge in 3D printing.
Is titanium 3D printable?
Yeah, sure.
It is. Wow. And that's the most common material, right, Yasser, in orthopedics?
Yes.
Yeah,
that's true, Bruno. Titanium is the most important metal printed in orthopedics. Most commonly printed.
I just have here a plate. It's a clavicle plate. It's in titanium. Okay, it's
right.
It's used every day.
Oh wow! Oh, that's excellent. I don't know a lot about orthopedics, but I hear the word titanium around the OR. Okay.
Normally it's titanium 64. It's alloy. It's titanium, aluminum, vanadium. And now people are trying to change vanadium that's toxic for niobium. Mm-hmm. So we are doing some research in this area in our country also.
Mm-hmm. Yeah, there will be advances in material science, I'm sure. Giu or Marco, the students can have questions too.
I'm just
equal time.
Thank you. I really like it. It was clean, all the explanation. I understand a lot. Congratulations. I was thinking about how it would be to use this material for the students. I help a teacher in anatomy, and when you talk about the anatomy to visualize the whole structure, I think how it would be to can learn with this material. You think it would be good, or?
Jill, I will answer this question. I have made my medical degree in a federal university here in Brazil. I have studied anatomy in, I think, cadavers that were 10 years used for anatomy. There wasn't many tissues to dissect. So I really think in countries like us in Brazil, to have the 3D printed models, to have 3D printed kidneys, to have 3D printed livers, to have 3D printed bones, can really help medicine in school medicine, because it's much cheaper than cadavers. It's much easier to do in cadavers. We don't have a big library of 3D files yet, but I really think in the future, I'm trying to do my work in orthopedics. I have a very large, but I really think with other doctors creating their own anatomy cases, every student could 3D print a brain, could 3D print a tumor in the brain, and it will be. I really think it will help a lot in 3D printing. We say children now should learn how to code, and I ask how to program an app and to code. And I really think medicine students should know a little bit about engineer, because to plan a surgery, to work in 3D files, you have to have a little knowledge about an engineer. I really think in med school should have some introduction to engineer, because I really think you're going to use.
Well, you know, you brought up an interesting point, Bruno. Like, you can send the blueprints of, say, a bone to Jorge, and he can print it exactly like that in another place. Right.
You are right, John. In fact,
I mean, that's a great advantage of doing of this field. You could do that, right to Jorge.
Yeah, right. For example, Bruno can work in a case in, I think that Bruno is in Rio Grande do Sul, in the state of Brazil. Santa Catarina, okay. And maybe we can share the same model virtually. We can develop maybe some specific plates or some specific device for his surgery, and then just package it and send by mail. And in 2 days or 1 day, he will have these options at the home to work on it. In fact, we do it at CTI. We do it with the hospital in all over the country. We've been working last year for more than 200 hospitals in the country. In fact, we are doing this many times, printing model, develop this model, but always connect with surgeons in all of the country to see what are their demands, because they know what are they asking for. We are just engineers.
Yeah, I know it applies to dentistry, because the dentist can send the 3D blueprints to someone in, say, Australia, and they can build a partial plate for someone, across the globe.
That's right.
Yeah, actually, sorry.
Go ahead, Bruno.
For example, we have a CAD software called ThinkerCAD. It's an online software you can open in your browser right now. You can import the 3D file of a bone, of a brain. You can, for example, plan your surgery online, share the link to your colleague. He can change anything. When it's done, you just send for your hospital, for example, to 3D print the guide. It's done. It's possible today, actually. But we need to have some knowledge of using some softwares, because these are not for medical. They are engineering software. But we can use today. We can plan a surgery right now if you want, all us together. It's not that difficult,
Mm-hmm. They are changing, Bruno. In fact, companies, they are aware of developed some tools that are useful for doctors, not for engineers, They have all of the background, all of the base of those software engineering, but they have to have a specific interface for doctors. So things are changing
George,
very fast.
George, I really know that, but this software is almost impossible to buy. You know, I have contacted some of them. I work myself. I work and I don't have a hospital behind me. I don't have a university. If you are alone as me, it's impossible to have this software. You have to use free software because the software they cost thousands of dollars, and for me, I'm sorry, but for me it's impossible. That's why in this presentation I have tried to show real software that real people can use, not only institutions, not only universities, because there are wonderful softwares for orthopedics out there. I have tried a few of them, but they are just a dream for me right now.
Well, you are right. You are right, Bruno. In fact, we started to develop the Vesalius many years ago because of it. You know, it was a demand. And now we are working with many universities, especially dental school and medical school, specifically trying to integrate free software, open source software. So many solutions can be possible. You are right. You are right.
You know, well, just to continue one thought that you mentioned, Bruno, one advantage that I see about this particular platform of Google Hangouts, it allows people like you, doctors, to get together easily with engineers, with material scientists from their home, very easily online. And you don't have to make a special trip to see an engineer or material scientist. You can easily use the Google Hangout platform to collaborate across disciplines, and I hope we can use this platform to do that.
John, you are right. You're right. I'm really glad to be here in connecting to you guys.
Yeah. Anytime you 3D printer guys, Yasser, Jorge, Bruno, if you want to get together with a material scientist or an engineer, anywhere, we'll try to put you together with them online. So, you know, they don't have to change their schedule and travel to your office. You know, I did the same thing with a conference in Google Glass in medicine. We tried a concept of what we call the Google Glass Agora, where we put the engineers and with the doctors to kind of throw around ideas, because you know, doctors would have questions about, would this be possible to build? And the engineers could easily say, oh yeah, you can do that, or you're limited by that. And they could more easily communicate what they wanted and what can be done. So anyways, okay, super presentation, Bruno. I'm thank you everyone for coming for our first presentation, and I hope to continue. Oh, I'm sorry, Marco, you get a chance to say anything. Do you want to say something or have a question?
Yes, I have a question. First, I have to say it was amazing presentation. Thank you so much. Have you ever tried in an orthopedic oncological surgery planning something like an osteosarcoma, maybe, in order to do a better job?
Yes, I really think for tumors, for oncology, for orthopedic oncology, or for any kind of oncology, 3D printing, I want to say it's important. I think it's almost mandatory today. I can imagine an oncology surgeon or an oncology orthopedics that doesn't know the 3D printing technology, or at least know it exists. For oncology, some things can be a little bit difficult, because some tumors are not very well seen in CT. When we need the MRI, we have a lower resolution to have a 3D file. That's important, I think, to try to explain for who's not a doctor. I'm going to, for example, a CT scan we have 200 slices. It's almost like a 200 megapixel camera, okay? When you have the MRI, oh, it's clear, but you have something like 20 slices. So it's almost like you had a 20 megapixel camera. So the resolution of the final 3D file is almost 10 times worse with MRI. It's possible to create an MRI, a 3D file from tissue, from bone, but today the resolution is not that good as in CT scan. Of course, there are other more technical explanations about that, but the simple way is to say we have 200 images in CT, 20 in MRI. So the resolution will be not that good. But of course, to plan where to place where to cut, and where are the arteries, where are the veins, and it's very important. I don't have these cases, thank God. I don't have these cases in my practice, but I'm pretty sure it's important. If anyone who is watching this webinar another time needs some help, I'm here to help to create a 3D file and work together.
Yeah, and Bruno, go ahead. I'm sorry.
No, sorry, John. Just some few words about MRI and CT. When you're talking about MRI, you can have very, very good image, fantastic image. The thing is that MRI is most specialized in soft tissues. It means that the response of your body is in the hydrogen, the spin of hydrogen. And when you're talking about CT, you are talking about mainly X-ray that's passing through your body. And then we are talking about bones, that's the most dense tissue in your body. It can hide the passage of X-ray. So you see more clear in the image. But also, they both are fantastic modality, but depends on the things you want to see, the anatomy you want to see. So it's quite different, but you're right.
That's correct. I was trying to explain. I don't think if I were okay. They are totally different. Okay. They are totally different exams.
Right.
I was trying when you reconstruct a 3D model, you reconstruct layer by layer. So you have 200 layers in CT. Depending on where it's on or it's not, you have 200 layers to reconstruct a file. So you have a nice file. A regular MRI, for example, the MRI I have here, I have 20 at least slices to reconstruct the same model.
But,
you know?
Yeah, you are right.
If you're doing manually, you know, if you draw, it's like to have a movie with 200 frames and a movie with 20 frames.
Bruno, but mainly because
movie, it's more detailed, but you won't have that smooth movement. I'm trying just to explain in a word, not about the exam, but how the 3D file is created in a software, you know?
Yeah, but they mainly has to change the MRI protocol, how they capture the image, you know?
Because yes, you can have more, but...
Yeah, that's right. Okay.
Okay, we'll just formally wrap this up, but everyone can stay. We'll chat after I end it formally. But I'd like to thank you very much, Bruno, and thank everyone else for coming. Good night.
Bye. Thank you very much. Thank you very much.